Pregnancy is full of surprises. From the moment you find out you're expecting, your body begins to change in ways you might not have anticipated. Some of these changes are exciting, while others can be a bit more challenging to deal with. One of the earliest and most persistent? Frequent urination. This is one of those quirks that almost every pregnant woman will experience at some point during her pregnancy. It's a completely normal and very common part of pregnancy. Your body is working hard to support the growing life inside you, and that means some of your organs, like your bladder, are under extra pressure. Don't worry, you're not alone. Many women find themselves making more trips to the bathroom than they ever thought possible. Almost every expectant mom experiences this at some point. It's one of those shared experiences that can actually bring you closer to other pregnant women. While it might feel like a minor inconvenience, understanding why it happens can help you feel more in control. Your growing uterus is putting pressure on your bladder, and your kidneys are working overtime to filter increased blood volume. Plus, knowing how to manage it can make your pregnancy journey a bit smoother. Staying hydrated is important, but you might want to avoid drinking large amounts of fluids right before bed to minimize nighttime bathroom trips. So, let's dive into the world of pregnancy pee. Understanding the reasons behind frequent urination can help you cope better and even find some humor in the situation. Frequent urination often starts very early in pregnancy. For some women, it's one of the first signs they're expecting. This can be due to hormonal changes that increase blood flow to the pelvic area. For some women, it's one of the first signs they're expecting. The increased levels of the hormone HCG can also contribute to this early symptom, and it can stick around for the whole 9 months, sometimes even longer. As your baby grows, the pressure on your bladder increases, making those bathroom trips more frequent. But the good news is that it's usually temporary. Once your baby is born, your body will gradually return to its pre-pregnancy state, and those frequent bathroom trips will become a distant memory. Blame it on the hormones. Yes, those tiny chemical messengers are the reason behind many of the changes you experience during pregnancy, including the constant need to run to the bathroom. During pregnancy, your body becomes a factory for a surge of hormones. These hormones are essential for the development of your baby and the preparation of your body for childbirth. These chemical messengers are responsible for many changes, including the constant need to pee. You might find yourself visiting the restroom more often than usual, and it's all part of the process. One of the main culprits is a hormone called human chorionic gonadotropin, or HCG. This hormone is produced by the placenta after implantation. This is the hormone detected in pregnancy tests. When you see that positive result, it's HCG that's giving you the good news. HCG levels rise rapidly in early pregnancy, increasing blood flow to your pelvic area. This increased blood flow is crucial for supporting the growing fetus. This includes increased blood flow to your kidneys, which filter waste and produce urine. As a result, your kidneys are working overtime, leading to more frequent trips to the bathroom. Another hormone, progesterone, also plays a role. Progesterone is essential for maintaining a healthy pregnancy. Progesterone helps prepare your body for pregnancy and childbirth. It supports the uterine lining and prevents contractions in the early stages of pregnancy. One of its side effects is relaxing the muscles in your body, including those in your bladder. This relaxation can make it harder to hold urine, contributing to frequent urination. This can make it harder to hold it and contribute to frequent urination. So, the next time you find yourself rushing to the bathroom, remember that it's all part of the incredible journey of pregnancy. Your body is working hard to support your growing baby, and these hormonal changes are just one piece of the puzzle. Embrace these changes and know that they are temporary. Soon enough, you'll be holding your little one in your arms, and all these bathroom trips will be a distant memory. Until then, stay hydrated, take care of yourself, and don't hesitate to take those bathroom breaks whenever you need them. Your body is doing an amazing job, and you deserve all the comfort you can get. As your pregnancy progresses, your uterus expands to accommodate your growing baby. This growing uterus puts pressure on your bladder, which sits right below it. This pressure reduces the amount of urine your bladder can hold, making you feel the urge to pee more often, even if your bladder isn't very full. In the first trimester, the uterus is still relatively small and contained within the pelvis. However, even this early growth can press on the bladder. As your pregnancy progresses into the second and third trimesters, the uterus continues to expand, eventually reaching well above your belly button. Frequent urination can ebb and flow throughout your pregnancy. Here's a general timeline of what to expect. First trimester. The constant urge to pee often begins in the first trimester, thanks to those hormonal surges and early uterine growth. Second trimester. You might get a bit of a break in the second trimester. As the uterus expands upwards, it takes some pressure off the bladder. Third trimester. Just when you thought you were in the clear, frequent urination often returns with a vengeance in the third trimester. This is because the baby's head descends into the pelvis, putting pressure on your bladder once again. Section 5. Taming the Tide Tips for Managing Frequent Urination. While you can't completely eliminate frequent urination during pregnancy, there are ways to manage it and make life a bit easier. Stay hydrated. It might seem counterintuitive, but drinking plenty of water is crucial. Dehydration can actually make frequent urination worse, and it can lead to other complications during pregnancy. Practice Kegel exercises. Kegel exercises strengthen your pelvic floor muscles, which support your bladder, uterus, and other pelvic organs. Strong pelvic floor muscles can improve bladder control and reduce urine leakage. Time your fluids. If nighttime bathroom trips are disrupting your sleep, try to reduce your fluid intake in the hours before bed. Section 6. When to worry, potential complications, and when to seek help. While frequent urination is usually a normal part of pregnancy, there are a few instances where it could signal a potential problem. It's important to be aware of these signs so you can seek help promptly and ensure both your health and the health of your baby. It's important to contact your doctor if you experience any of the following symptoms, as they could indicate a more serious issue that needs medical attention: pain or burning during urination. This discomfort can be more than just an annoyance. It could be a sign of a urinary tract infection, which are common during pregnancy. UTIs need to be treated with antibiotics to prevent complications. If left untreated, they can lead to more serious kidney infections, which can be harmful to both you and your baby. Blood in your urine. This can also be a sign of a UTI, but it could also indicate other issues such as kidney stones or more severe infections. It's crucial to get this checked out immediately. Severe leakage. While some light leakage is normal, especially when you sneeze or cough, experiencing heavy leakage or an inability to control your bladder requires medical attention. This could be a sign of a more serious condition, like a bladder infection or even preterm labor. Additionally, if you notice any other unusual symptoms such as a high fever, chills, or severe back pain, these could also be signs of a more serious infection or complication. Always err on the side of caution and consult your healthcare provider if you have any concerns. Your health and the health of your baby are paramount, and it's always better to be safe than sorry. Section 7. After the baby arrives, postpartum urination patterns. You might be wondering, when will I finally stop peeing all the time? The good news is that frequent urination typically subsides after childbirth as hormone levels return to normal, and the pressure on your bladder is relieved. However, in the first few days after delivery, you might experience something called postpartum diuresis. This is a fancy way of saying you'll be peeing a lot as your body flushes out excess fluid that built up during pregnancy. Section 8. Kegel exercises, strengthening your pelvic floor for better control. Kegel exercises are like a workout for your pelvic floor muscles. They're easy to do and can make a big difference in bladder control, both during and after pregnancy. Here's how to do them. 1. Find the right muscles. Imagine you're trying to stop yourself from passing gas or urine. The muscles you squeeze are your pelvic floor muscles. 2. Squeeze and hold. Tighten your pelvic floor muscles and hold for a count of 5 seconds. 3. Relax. Release the muscles and relax for a count of 5 seconds. 4. Repeat. Aim for 3 sets of 10 repetitions per day. Section 9. The finish line. Reassurance and final thoughts. Frequent urination is a common and usually harmless part of pregnancy. It's primarily caused by hormonal changes, pressure from your growing uterus, and increased blood volume. While it can be annoying, remember that it's temporary. By staying hydrated, practicing Kegel exercises, and timing your fluid intake, you can manage the urge to pee and minimize disruptions to your day-to-day life. If you have any concerns about frequent urination or experience any unusual symptoms, don't hesitate to talk to your doctor. Congratulations on your pregnancy, and remember, you've got this.